Every night, roughly 7 hours pass where you have almost no control over your own body. You cannot check your posture. You cannot correct your alignment. You simply lie there, unconscious, while your head rests at whatever angle gravity and habit put it in. And for millions of people, that angle is quietly squeezing one of the 4 arteries that feeds blood to the brain. Here is the part almost nobody talks about. A neurologist looking at brain scans of stroke patients does not just look at cholesterol and blood pressure anymore. They look at neck position. They look at pillow height. They look at whether a person sleeps with their chin tucked hard to one side, night after night, for decades. Because a compressed artery in the neck, repeated thousands of times, behaves very differently than a healthy one. Today, I am going to walk you through exactly how sleep position and neck angle can restrict blood flow to your brain, why sleep apnea is far more connected to stroke risk than most people realize, and what a neurologist actually wants you to check about the way you sleep tonight. This is not about fear. It is about understanding a mechanical and physiological process that is completely within your ability to change once you know it exists. To understand why sleep position matters this much, you need to understand the vertebral arteries. Most people have heard of the carotid arteries, the 2 large vessels you can feel pulsing on either side of your neck. But there is a second, smaller pair of arteries running up through a narrow tunnel of bone in your cervical spine, called the transverse foramen. These are the vertebral arteries, and they merge at the base of the skull to form what is called the basilar artery, which feeds the brainstem and the cerebellum. Think of your carotid arteries as the 2 main highways delivering blood to the front of your brain, the part responsible for thinking, memory, and movement. The vertebral arteries are the back roads, but they feed something just as critical, the brainstem, which controls your heart rate, your breathing, and your balance, and the cerebellum, which coordinates movement. A blockage on the highway is dangerous. A blockage on the back road that controls your breathing and heartbeat can be catastrophic. In a healthy neck, at a healthy angle, these arteries have room to do their job. But because they travel through a bony tunnel rather than open tissue, they are far more vulnerable to compression from extreme rotation or extension than the carotids are. As we age, arteries naturally lose some elasticity, and the tissue around the spine can develop small changes in alignment. This means a rotation or extension that a 25-year-old's neck could tolerate without issue may meaningfully reduce blood flow in someone who is 60 or 70. So the question becomes, can something as simple as a sleep position actually restrict blood flow enough to matter? And based on decades of case studies and imaging research, the answer is yes, for a meaningful subset of people. Let's go deeper into the mechanism, because this is where it gets genuinely interesting. There is a well-documented clinical phenomenon called rotational vertebral artery compression, sometimes referred to by the more dramatic name Bowhunter syndrome, because it was first identified in archers who would turn their heads sharply to draw a bow and briefly lose consciousness. What researchers found on imaging was that extreme neck rotation was physically pinching the vertebral artery against the bony structures of the spine, cutting blood flow to the brainstem in that instant. Now, most people are not turning their heads that sharply while awake. But here is the connection to sleep. Many people sleep with their neck rotated close to that same range, especially side sleepers whose pillow is too high, too flat, or mismatched to their shoulder width, forcing the neck into a sustained lateral bend for hours at a time. Unlike the archer's brief rotation, this is a sustained compression, repeated night after night, for years. A study out of a major sleep medicine center used Doppler ultrasound to measure blood flow velocity in the vertebral arteries across different head positions and found that extreme rotation combined with extension, the position many people unconsciously fall into when a pillow pushes the chin up and the head sideways, reduced flow velocity on the compressed side by a clinically significant margin in a meaningful percentage of the participants tested, particularly those over the age of 50. With pre-existing changes in the cervical spine. Here is the biological chain reaction. When blood flow through a vessel is repeatedly restricted, even in short episodes, the inner lining of that artery, called the endothelium, experiences changes in shear stress, the friction of blood moving across the vessel wall. Healthy, smooth shear stress keeps the endothelium calm and functional. Turbulent, interrupted shear stress activates inflammatory signaling and can accelerate the buildup of arterial plaque right at that specific site of compression. Think of it like a garden hose that gets kinked in the same spot every single day. Eventually, that spot in the hose degrades faster than the rest. This is where sleep apnea enters the picture, and it connects to the very same brainstem and blood vessel system. Obstructive sleep apnea happens when the soft tissue at the back of the throat collapses during sleep, repeatedly blocking the airway. Each blockage causes a brief but real drop in blood oxygen, called intermittent hypoxia. Your body responds to that oxygen drop the same way it would respond to a genuine emergency: a surge of stress hormones, a spike in blood pressure, and a jolt that partially wakes the brain to reopen the airway. This can happen dozens, even hundreds of times in a single night, without the person remembering a single one of these awakenings. A large cohort study following adults with untreated moderate to severe sleep apnea found that participants had a substantially higher rate of silent cerebral infarcts, small strokes that show up on brain imaging but never produced an obvious symptom the person would recognize, when compared with participants without sleep apnea. Silent strokes are exactly what they sound like. They do not cause the dramatic, one-sided weakness or slurred speech people associate with a stroke. Instead, they show up years later as memory changes, balance problems, or a general cognitive decline that gets written off as normal aging. There is also a second pathway worth understanding, one that connects more directly to what shows up on a brain scan years later. Each time oxygen drops during an apnea event, the body's stress response releases a surge of catecholamines, the same family of hormones responsible for the fight or flight reaction. This surge spikes blood pressure sharply, sometimes by 20 or 30 points, for the seconds it takes to reopen the airway and restore breathing. A single spike like that, in isolation, is not dangerous. But repeated dozens of times a night, for years, it behaves like a hammer tapping the same spot on a windshield. Each individual tap looks harmless. The cumulative effect is a network of small, hidden cracks, in this case, in the delicate small vessels deep inside the brain that are most vulnerable to pressure surges. This is very often where silent strokes are found on imaging, not in the large arteries, but in these small, deep vessels that simply cannot tolerate repeated pressure spikes indefinitely. So now you can see how these two mechanisms compound each other. A person sleeping with a compressed vertebral artery is already delivering less blood to their brainstem and cerebellum for hours every night. If that same person also has undiagnosed or poorly managed sleep apnea, they are adding repeated oxygen drops and blood pressure spikes on top of that reduced flow, hundreds of times a year, for years. And this is where food and lifestyle come in less than positioning and airway management do. So let me show you exactly what a neurologist wants you to check and change. The first thing to address is pillow height and sleep position itself. A pillow that is too thick pushes the head upward and often sideways when you are on your side, forcing the neck into that sustained lateral bend we talked about. The fix is choosing a pillow that keeps your nose in line with the center of your chest and sternum, whether you are on your back or your side. A simple way to check this at home is to have someone take a photo of you in your usual sleep position. If your neck is visibly bent upward, downward, or sharply to one side, that is a sign your pillow height needs adjusting. The second area is stomach sleeping, specifically. Sleeping face down forces the neck to rotate to one side for the entire night, often close to that 90-degree range associated with vertebral artery compression in the case studies. If you are a committed stomach sleeper, the practical shift is transitioning toward side sleeping with a supportive pillow between the knees for spinal alignment, or back sleeping with a small pillow under the knees. This is not an overnight habit change. It typically takes several weeks of conscious effort, sometimes with a pillow or wedge that discourages rolling onto the stomach, before the new position feels natural. The third area, and arguably the most important, is recognizing the signs of sleep apnea and taking CPAP compliance seriously if it has already been diagnosed. The classic warning signs include loud, chronic snoring, gasping or choking sounds during sleep reported by a partner, morning headaches, and daytime fatigue that does not improve with a full night in bed. If any of these sound familiar, a sleep study, which can now often be done at home with a portable monitor, is the next concrete step. The fourth area is CPAP neglect specifically, because this is where a lot of progress gets undone. Studies tracking CPAP adherence have found that a substantial portion of people prescribed the therapy use it inconsistently, removing the mask partway through the night or skipping it on nights they feel tired, which happens to be exactly when they need it most. The therapeutic benefit of CPAP is dose-dependent, meaning the protective effect against blood pressure spikes and oxygen drops scales with how many hours per night, and how many nights per week, it is actually worn. Neurologists generally look for at least 4 hours of use per night on the large majority of nights as the threshold associated with measurable cardiovascular benefit. The fifth area is neck and cervical spine health more broadly. Because vertebral artery compression risk increases with cervical spine changes, gentle range of motion exercises for the neck, done while awake and seated, can help maintain flexibility and reduce the degree of extreme rotation the neck defaults to during sleep. This is not about forcing your neck into new positions. It is about maintaining the mobility that keeps your resting position closer to neutral. The sixth area is mattress firmness, which most people never connect to neck alignment at all. A mattress that is too soft allows the shoulders to sink deeper than the head and neck, which changes the effective angle of the pillow underneath it, even if the pillow itself is the correct height. If your mattress has visible sagging in the shoulder and hip area, that alone can undo an otherwise well-chosen pillow. A firmer mattress, or a mattress topper that restores a more even surface, keeps the neutral alignment you worked to establish from being quietly cancelled out by what is happening a few inches lower. The seventh area is alcohol and sedative use in the hours before bed. Alcohol relaxes the muscles of the throat and tongue in the same way it relaxes muscles elsewhere in the body, which makes airway collapse more likely and often more severe in people who already have some degree of sleep apnea. It also tends to deepen sleep in a way that makes people less likely to shift position naturally through the night, meaning a compressed neck position gets held for longer stretches than it otherwise would. Limiting alcohol within 3 to 4 hours of bedtime addresses both problems at once. Now let's talk about the mistakes people make once they know all of this, because good intentions do not always translate into good execution. The first mistake is buying a new pillow without actually measuring for it. People grab a pillow labeled cervical support or orthopedic without checking whether the height and firmness actually keep their specific neck and shoulder width in neutral alignment. The fix is simple: use the photo test described earlier, and be willing to try more than one pillow before settling on the right fit. The second mistake is assuming that because you do not snore loudly, you do not have sleep apnea. A meaningful portion of sleep apnea cases, particularly in women and in people who are not significantly overweight, present with quiet or minimal snoring but still involve real airway collapse and oxygen drops. The fix is not to rule out a sleep study based on snoring volume alone. If daytime fatigue and morning grogginess are present despite adequate hours in bed, that alone is worth investigating. The third mistake is treating CPAP as optional on good nights. The intermittent hypoxia and blood pressure spikes do not pause because you feel fine. In fact, some of the most damaging nights are the ones where a person feels rested enough to skip the mask, because that skipped night still carries the same physiological cost. The fix is building a habit loop around the mask the same way you would with a medication, worn every night regardless of how you feel. The fourth mistake is ignoring positional habits during naps and rest, not just nighttime sleep. Falling asleep in a recliner with the head tilted sharply to one side, or napping on a couch arm that forces neck rotation, exposes the vertebral artery to the same compression pattern in shorter bursts throughout the day. The fix is applying the same neutral alignment principle to any extended rest position, not just your primary nighttime sleep. So what can you actually expect if you make these changes? Within the first few nights of adjusting pillow height and sleep position, many people notice a reduction in morning neck stiffness and, for some, a decrease in the mild morning headaches that can accompany restricted blood flow overnight. This is a comfort signal, not a medical measurement, but it often reflects that the neck is spending less time in extreme positions. Within 2 to 4 weeks of consistent CPAP use, for those who needed it, most people report noticeably improved daytime energy and mental clarity, as the brain is finally getting uninterrupted oxygen through the night. Within 3 to 6 months, blood pressure readings often begin to trend downward for people whose hypertension was being driven in part by undiagnosed apnea, since the repeated overnight stress hormone surges are no longer occurring hundreds of times a month. Longer term, over the following 1 to 2 years, this is where the real protective value shows up. Consistent CPAP use combined with reduced vertebral artery compression during sleep is associated, in the research tracking these outcomes, with a meaningfully lower incidence of new silent infarcts on follow-up brain imaging, compared with people who continued to sleep with untreated apnea and habitually extreme neck positions. Here are a few practical tips that make all of this easier to actually stick to. When choosing a new pillow, bring a rolled towel to a store or use one at home to test different heights before committing to a purchase, since the right height depends entirely on your individual shoulder width and mattress firmness. If you are a side sleeper transitioning away from stomach sleeping, place a firm pillow lengthwise against your front, which naturally discourages rolling face down during the night. For CPAP compliance, most modern machines track usage data automatically, so ask your sleep specialist to review your compliance report at each follow-up rather than relying on memory of how the nights felt. If loud snoring or gasping has been reported by a partner but you have not yet had a sleep study, home sleep testing kits have become widely available and are typically far less costly and disruptive than an overnight lab study, making that first step easier than most people assume. And finally, if you wake up with dizziness, brief vision changes, or numbness specifically when turning your head to one side, mention this explicitly to your doctor, since this specific pattern is exactly what prompts investigation for vertebral artery involvement. The mechanism underneath all of this comes down to two systems working against your brain's blood supply at the same time: a neck position that can mechanically restrict one of the arteries feeding your brainstem, and an airway that can repeatedly cut off oxygen if sleep apnea goes unmanaged. Neither of these is something you have to simply accept as an unavoidable part of getting older. A pillow adjustment, a positional change, and honest, consistent use of a prescribed CPAP machine are all fully within your control. You do not need to fear the 7 hours you spend unconscious every night. You simply need to make sure your body is set up to protect itself during them.